All right, I believe that we are live. Hello, everybody. I'm super excited about tonight's, I was about to say today, but tonight's interview. If you don't know me, I'm Dr. Leslie Francisco McClendon. I have the privilege of serving as the senior pastor of C3 in Hampton, Virginia, and it is my honor to have you on tonight. If you would do me a favor, I love to engage with people. So if you would just let me know your name, put it in the chat, let me know where you're watching from. I would love to shout you out. I see that my mother is online, one of our oversight pastors, Dr. Natalie Francisco. Hello. If you have not done so already, would you do me a really, really big favor and share this broadcast? I believe that this is going to be extremely helpful. And we want to help as many people as possible. I see Nicole is in the chat. Who else is with me watching from Facebook or YouTube? Let me know so I can say hello to you. And before we get into it, I promise to honor your time as always, but we just have a few announcements. If you did not know, the month of October is actually Breast Cancer Awareness Month. And I wanted to let you know that we have a limited amount of t-shirts available. They'll be available on Sunday. I'm going to put them up right here. Here they are. You know, at C3, we love to say that we are legacy makers and curse breakers. And so this is our special edition Legacy Maker Breast Cancer Awareness Tee. And we're going to be selling them on Sunday for $20. Cash or cash app only. This will be made available for purchase on Sunday, and all proceeds are actually going to go to benefit the American Cancer Society. And so I'm excited about that. We have sizes from small to 3X. But we'll also be participating in a breast cancer walk as a church family Sunday. And so we're going to meet at Newport News Park at 11:30 a.m. So Sunday, please make sure to wear your comfortable shoes and pink if you have it. And we would love for you to support again by purchasing one of these shirts on site Sunday for $20. And again, those proceeds are going to benefit the American Cancer Society. For those of you who are tuning in, thank you so much. I see Zainab. I see Miranda. I see Andrea or Andrea. I'm not sure which way you pronounce it. My middle name is Andrea, by the way. I see, hey, Dr. Carol is here. Sharika is here. Kashama is here. So many people. I'm so glad. We're going to jump right into it, but I'm going to ask you one more time, if you haven't done so just yet, to share this broadcast. And so we're going to be talking about overcoming and dealing with anxiety. And this is actually going to be part 2. On church this past Sunday, October the 10th, if you didn't know, it was actually, I think, World Mental Health Day. And so we had a chance to sit down with a licensed professional counselor and really talk about anxiety. And it went over really, really well. That we decided to do a part 2. And so I'm getting ready to introduce Megan to you. Megan is a licensed professional counselor. She is certified in anxiety treatment. And so she knows what she's talking about. She's got a lot of credentials, but she could probably introduce herself better than I can. But I'm so excited to invite her to the screen. So would you do me a favor and just put your virtual hands together and help me welcome Megan to the platform as she comes. What's up, Megan?
Hey, hi. How is everyone?
So I think we're good.
I'm seeing it too. Hey, you guys.
Caleb and Lauren, hello. Thank you so much for agreeing to meet with us again and to carry this into part 2. You know, we had a powerful time.
Absolutely.
But we ran out of time.
Yes, we did.
I know. So we thought that it would be appropriate to add another segment where we could talk a little bit more candidly and also take questions. And so the Sunday when we did the interview, I was asking all the questions. I still have more questions. I told you I really don't run out, but I've got some help in the chat for those. I know, I'm sorry. I've got some help.
No, don't apologize.
Wonderful, because I'm excited for round 2. And I know that there are some people who probably have a lot to ask for you as well, and that they're looking forward to part 2. And so for those who may have missed the interview, and I hope you've shared, if you haven't done so, please do that. But for those of you who may have missed our interview on Sunday in part 1, Could you just give us a high level view of anxiety again? Tell us what it is and what it isn't.
Yeah. So and also hi everyone, saying hey in the chat. So and we touched on this on Sunday, but when you think about anxiety, you think about excessive worry, and fearfulness and dread and having those intense um, ideas that something bad is going to happen in some capacity. Um,
Mm-hmm.
and we touched on those different, some of the different types of anxiety disorders, not all of them, but some of them. But yeah, that is, when you think of anxiety, it is that worry or fear that something bad is going to happen.
And I think one of the things that you made sure that we were aware of as well is that anxiety is future tense. So this
Mm-hmm.
has nothing to do with the present or anything in the past. Anxiety very much stems from what has not happened, or your fear of what may happen in the future, right?
Right, right. And then we mentioned how sometimes we can use anxiety where we're actually referring to stress. And those things can they can coexist where we are literally experiencing overwhelm or stress in our current life, right? Because overwhelm and stress is like I'm carrying things in such a way where it's impacting me negatively in my present tense. And that can start to impact and activate anxiety because then I begin to worry about what's to come.
Mm. Yeah.
That makes sense?
I had someone
Cool.
tell me too that they didn't know that stress and anxiety were two separate things.
Yeah, yeah, and that can, again, that can happen. So we can use those synonymously, but they are actually different. Stress and both of these things can exist in our worlds and
Mm-hmm.
will exist in our worlds, and they can exist in our worlds in healthy ways and in healthy levels. So just because you're experiencing a level of stress, just because you're experiencing anxiety, that does not mean that it is unhealthy or that something's wrong there. It's when our levels of stress and anxiety reach a point where they're debilitating our lives or they're keeping us from engaging in our lives in healthy and helpful ways. And that is existing for long periods of time. That's
Mm-hmm.
where it's now reached that unhealthy level.
That's good. Well, can you tell us what are some of the signs of anxiety? I know we mentioned stress, but are there any other blanket signs?
Yeah, so you can have all of these happening, some of these happening. Um, we experience anxiety in our bodies and mentally,
Mm-hmm.
and of course, emotionally, right? So, from a physical standpoint, you can start to experience um, dry mouth. You can experience some common ones are like my chest hurts. I feel like I can't breathe. I can't seem to catch my breath, or my breath is really shallow. My hands are really clammy. My muscles are really tense. Um, I feel really tingly. I start to sweat when I'm not really engaging in activity or there's really not a reason for me to be sweating. You can have stomach pains, nausea, or diarrhea. Those things can
Wow.
occur when your anxiety is activated. Um, Headaches, I don't know if I mentioned those, migraines, your vision can become blurry. All of these are physical symptoms that can be present when our anxiety is activated. And then
Mm-hmm.
from a more cognitive or like a mental standpoint, when you find yourself ruminating over thoughts, or thoughts are constantly like cycling in your head, and it's like a swarm, and you can't get, you didn't ask them to be there. They're there, they're intrusive, and they're there, and they won't let up. When your thoughts are racing all the time, when you are constantly having worrisome thoughts that don't seem to level out, or they're really out of proportion with the situation too, those are symptoms that occur when our anxiety is activated.
Wow. I remember us talking too, and you said how important it was to approach anxiety from a holistic perspective. And I don't know if I've asked you this before, but is there a such thing as spiritual anxiety?
Ooh, I don't. What do you, when you say that? What do you mean?
I don't know. I was just thinking about it. Like, let's say, like, for someone who's deeply embedded into religion, and maybe the way that they grew up, they were taught like salvation, heaven or hell. And so you're like, oh my gosh, if I don't dot every I and cross every T, like, what is my, where am I going to end up? Like, could that be a form of spiritual anxiety? Maybe just always wrestling with
Yeah.
what about the afterlife, or is this a demon or something like that? Like, could that be a
Mm-hmm.
byproduct?
I think, what you're describing really speaks to how our beliefs about something
Okay.
and our patterns of thought absolutely impact our activation of anxiety, right? So, like you said, if I was, and this is where, and this is helpful when you consider that anxiety doesn't manifest from like one thing, right? Like, or when our anxiety has reached that level where it's really not in a healthy space, that can be impacted by a lot of things. And so if we could take that into consideration and we say, okay, a person grows up in an environment where they're constantly hearing, you have to follow these guidelines spiritually to a T, and if you don't, that's it for you. Well, of course, it would be understandable for that person to maybe start to feel like they're on a tightrope, right? Like, if I have to walk in such a way and I have to be perfect, and perfectionism is one of those things that really impact our levels of anxiety. If our thoughts have that perfectionist spin on it, if our
Yeah.
beliefs are really filtered through perfectionism, then nothing is ever good enough. I have to be, I have to get it exactly right, and there is no room for error. And so, of course, without any room, your anxiety is going to be um, constantly and what's the word I'm looking for? Sensitive, right? It's going to be really, really sensitive to making errors. So you're going to be constantly looking to not make an error. So you're
Yeah.
always on edge.
And I wonder, even is anyone in the comments besides me, have you ever dealt with perfectionism before? It can be very debilitating. And I just wonder, as we're talking about it, for those of us who may deal with that, are there any strategies to maybe overcome that or work through that? And also, if you have any questions in the comments, feel free throughout the night to post them as well, so that we can get Megan to answer them. But I know for years, and there are still times where I deal with perfectionism, and even in my head, there are times where I feel like I should be farther along than I am now, but because
Yeah.
the season or the moment wasn't exactly as how I thought it should be, I didn't take that step or that jump. But what would you say to people like me and those in the comments who kind of deal with that perfectionism? How can we rise above that?
Yeah. So as you can see, so here's one strategy in itself. Oftentimes we can use some distorted lenses and we'll go, only me. I'm the only one that goes through this, right? And that kind of exacerbates our anxiety even more. But one strategy is like, take a look. Like, if you look at the chat, there's like multiple hands raised, people saying me. like this is something that more than just one person experiences, right? So then if we go like that, we say, okay, well, I'm not alone in this. That in itself provides a sense of comfort. And then that leads me to a very helpful thing that we can do for ourselves is learn self-compassion and learn validation. So if before we can go to try to fix something, right? Like, how do I fix this? Well, first, let's be able to acknowledge that it's there, acknowledge that it's real, observe it, and say, okay, you know, I'm really struggling right now with perfectionism. I can see it. That is, I'm labeling it accurately. That is perfectionism right there. And just be able to validate that for us first. So if I deny it, if I minimize it, if I try to avoid it, if I try to pretend like it's not real, then I lose an opportunity to kind of turn to it, embrace it for what it is, so that I can then start to work towards making that better for myself, right?
So you believe naming something is the step to healing, or one of them?
Yeah, absolutely. Right. And then, like, okay, if we go spiritual with that, we have scriptures in our Bible that tell us, like, to, you know, to speak accurately about things, right? To call things for what they are. And that is very helpful. So even with our emotions and what we're going through, if we're able to say, this is what is here in this moment with me, then we don't try to treat something that it's not. You wouldn't go in a doctor's office and lie about your symptoms and then expect for your doctor to treat some symptoms you just lied about.
Right. That's true.
So if you went in and you knew that you were having pains in your left arm, and your doctor says, all right, well, tell me what you're feeling. And you say, I'm fine. My left arm is fine. I have a splinter on my right hand. Well, your doctor is going to start to treat this right hand based off of what you label. So in the same way, if we do that, if we say, okay, perfectionism is something that exists, and it is something that I can do, and that can be really hard for me. Well, right then and there, from an emotional standpoint, that's helpful, but from a cognitive standpoint, that is helpful. When we acknowledge that it does actually help the activation in our brain in those areas where anxiety and distress, are.
Yeah, and you also said something about self-compassion and validation. What is an example of that? I know you mean like to love yourself, but like, is this mirror work, or do we do sticky and post-it notes and like repeat them every day? What does that look like?
Okay, so some self-compassion. Okay, a really simple one that we all, I think, have been able to do with others. So if we use the best friend treatment strategy, right? This is where, and for those that are parents, we can do it similarly this way. So imagine your best friend comes to you and says, Leslie, I've just been really struggling with perfectionism. I just feel like I have to get everything right all the time. If I don't get it right, then, everything is going to fall apart. I'm really struggling with this. My head is just constantly I'm always thinking about, I can't make any mistakes. Mistakes are just not an option for me. So if your best friend, who you love dearly, comes to you with this, how do you respond to that? Do you say, are you likely to say like, yeah, girl, I can see why you think like that. Like, you right. You better not make no mistakes.
I mean, you could, but it's probably not helpful.
Okay. Right.
I don't think.
Are you likely to do that?
No.
Right. And most often we don't. a lot of times, and really what we tend to do first is we meet that person with compassion, and we meet that person with calmness, right? We're like, okay, like take a deep breath, why don't we try to calm down a little bit? And I see that you're going through a lot. I can see it. Like I see that's hard, and then we're there to be compassionate and express how we understand what they're going through and how what they're going through is valid. Now, a friend who may not, who you might not consider like a healthy friend might be like, girl, like, whatever, you ain't going through nothing. If you're hearing that, you wouldn't count that as like good sound advice or like a friend who's really being supportive and compassionate. Mm-hmm. Right? Yeah. But often that's what we do to ourselves. When we're being critical of ourselves, when you're like, just suck it up, Leslie, like, stop, like, you're being stupid right now. That is you being that critical friend that you would not dare be to anybody else. Mm-hmm. So the way that we do self-compassion is the things that you are extending to your closest friends, to the people that you love the most. You flip that and you turn that onto yourself using the exact same language.
That we often have more grace for others than we do for ourselves. At least the perfectionists do. It's like, if I see you struggling with perfection, I have more of a heart to help you. But when it comes to myself, it's like we put ourselves kind of on the back burner, like,
Yeah, absolutely. And so here's the thing to remember with that. It's not because of capability, right? So we've proven to ourselves we are capable of practicing compassion. We're capable of extending this in some direction, right? So we can't say to ourselves, I don't know how to do that. Yeah, you do. You know how to do that. Just right now, you're extending it in a direction that is not headed your way. So if we go, all right, actually, I do know how to do that. I just haven't really done that to me. Mm-hmm. Then we can start to go, okay, it's not a capacity thing. It's not a capability thing here. I am capable of doing it. I just haven't really practiced that. That hasn't been my norm, but it can be.
No, that's good. And even swinging back to anxiety, we have a question in the comments. Before we get to that, can anxiety be masked or confused for something else? I think at one point when we were talking previously, you said that some anxiety symptoms may look like ADHD. Could you maybe talk about that a little bit?
Yeah, so some of these symptoms that you will see in what we would consider like anxiety disorders, they are also symptoms that you see in other conditions. And so this is why it's really helpful to make sure that you're teaming up with your healthcare professionals when it comes to diagnosis, right? So that's one thing that I want to make sure that we put out there. You do not have to right, like you don't have to self-diagnose yourself first to go get help, because sometimes we do that. We're like, let me make sure this is an issue before I go. It's like if you clean up your house before you have a cleaning person come over, that kind of thing. So let me make sure I diagnose myself first so that I can, then go to the professionals. You don't have to do that. So it is actually really helpful to go ahead and team up with your healthcare professional so that you guys can have an accurate historical account and look at your health conditions, any health conditions that you may have, what medications you might have taken or are taking, and doing those assessments that can be really helpful so that you can get an accurate account of what might be going on there. Because there are certain medical conditions, certain heart conditions, certain brain conditions that will have symptoms that are also seen in anxiety. And so we might not say like you have an anxiety disorder based off of the fact that these other things are present, and they're really the root of why you're experiencing these symptoms.
Mm. And even speaking of seeking out a healthcare professional, there's a question in the comments that said, "Are
I see
counselors
you,
and
Kashana.
so are counselors and therapists the same, or is there a difference between the two?"
There are differences. We tend to, like, I'm a licensed professional counselor, but the term therapist gets used, and that is okay. There are some credentials that are different, but they'll still refer to what they do as therapy. For example, like LCSW, which is a licensed clinical social worker who practices therapy. Their credential is LCSW, but they refer to their title or what they do as therapist or therapy.
Okay. Okay. Well, I had a question too. It looks like Nicole said the same, but I worded it as, can anxiety come from lack of sleep? But she asked, can anxiety also be masked as insomnia?
So insomnia can be so sleep, impact of sleep is a symptom that we see when it comes to both anxiety and depression, right? Is our sleep, our healthy sleep patterns impacted right now? If we're saying we either can't sleep, or we have trouble falling asleep or staying asleep, or we're sleeping too much, like we're sleeping 12, 14 hours a day, we're waking up, we're right back to sleep. These things can be related to anxiety and other conditions as well, like depression is one that's really also sleep is impacted by.
Yeah, and that's actually a
Now,
question.
I will say,
Them up. Go ahead. I'm sorry.
no, that's okay. So what we do know for sure is that sleep deprivation impacts anxiety activation. So we do know that. We know that if we are depriving ourselves of sleep continuously, then it is more likely that the parts of our brain that activate when we see anxiety, they are more prone to activation. So know that your sleep schedule and your sleeping regimen actually can be very helpful or hurtful when it comes to you trying to really get your anxiety in a workable and helpful place.
Got it. Now, what if I have this anxiety or sleep deprivation or whatever for 6 months or longer versus one day? So one day, okay, but what if this is like persistent? What do I do? Do I seek help? Like
Yeah.
for someone who's been, this has just been hanging over my head for far too long. What do I do?
Yeah, so that persistence where it has gone on for months and months and months, that's one of those key signs that, hey, it might be really helpful for me to go ahead and start seeking out a healthcare professional to really start looking into this, because again, our anxiety activating situationally, right, where it's not happening all the time, and also it happening, and then it's able to come back down, and we're able to still function and do those things that we do to live our lives, like sleep and eat and go places and finish our tasks and go to work and go to school, engage with our families, have that sense of self that is still intact. If we're seeing that for months on end, all of these things are starting to get impacted, and we're constantly worried. We can't sleep. Our thoughts are just racing and racing at the end of the night, and it won't let up. That's a good kind of signal to let you know that it might be a good idea to go ahead and start, seeking some help there.
So I know you
I
say
saw
there.
Kashama's question come on the screen. Can anxiety bring on depression?
Mm-hmm.
Yeah. So yes, Kashama, we know that that anxiety and depression definitely can impact each other, and rightfully so, right? So if we look at this from if you're experiencing anxiety and it is debilitating you, and you're constantly worried and you can't do things, what tends to happen? You start to feel hopeless. You start to feel down. You start to feel depressed. You start to, your confidence is shot. You start to lose interest in the things that matter to you. Your sleep is impacted. You can't eat. All of those are the symptomology that we see in depression. So yes, absolutely. Those, they can definitely, anxiety can create depression with us.
So I know we talked about like 6 months, but is there a time limit on when we might need to see someone in the healthcare profession? Like, is it something past 30 days? So I'm thinking like, what about grief? Or let's say we lost a loved one or something, and does anxiety have something to play with grief? Or like, is there normal grieving time, or is it, hey, after 30 days, if you still are grieving the same as when the loved one passed, I need to seek help? Or what is your insight on that?
So, seeking help, if we put a timetable on that, then we might not really do ourselves the best service there, right?
Yep,
So
that's
let's
true.
say, right, like let's say you are grieving. Let's say you have experienced the death of a loved one, and your grief in the first week is so debilitating that now you can't function. And we would say, well, there is help and resources available in this world, and you have every right to seek that out. Let's say, because everyone experiences things different, you're just on autopilot, and it doesn't actually really hit you until 2 months later, right? Because you're going and you're going and you're doing all the things, and you're surviving. And then you get to the point where you realize, I'm not okay. We
Mm-hmm.
wouldn't say, well, you missed your window. You should have reached out.
Yeah.
You missed it by 2 weeks. Sorry. So whenever we are able to recognize that our level of functioning is really impacted here, it is okay for you to seek out the help that you rightfully deserve, whatever time period that is.
No, that's helpful. I think that's good. And this is a question I had too. Are there over the counter anxiety medications, or should you always consult a doctor or therapist before seeking out medicine to help with anxiety?
I think it is really a safe protocol to discuss things with your healthcare professionals, um, because they're going to be able to have those conversations with you and give you insight on medications and how they impact your health. Now, are there over the counter medications now that promote calmness and relaxation, or natural help with sleep like melatonin and things like that? Those are out there, but I think it's a safe practice to definitely talk to your medical providers about what you're experiencing, and how to how medications may be helpful to incorporate.
Okay. And maybe this will be in the same line of thinking, but, or it might be ask your medical professional, but in the event you are prescribed medication, can you wean yourself off, or is this something that you are taking long term, and once you start medication you're just kind of on it?
Yeah, so definitely have those conversations with your medical provider, whether you're being prescribed medication from like a psychiatrist or a nurse practitioner or your PCP, whoever that person is. I think it's one, it is your absolute right to have those conversations with your medical professionals to say, like, this is what's going on with me. This is what I'm experiencing. This is what I'm hoping to get, from treatment. And when you're on medication, to be aware of how you're feeling and what's going on there, and then sharing that with your medical provider, right? Some medications are medications that are for long-term use. Some medications are more for short-term use. And so being able to have those conversations with your medical providers and ask those questions, like, is this a medicine that I can safely be on for a long period of time? Or if you're having those thoughts, I don't want to be on medication forever, you can have that conversation with your medical provider and to be an advocate and be a part of your medical treatment in that way. You have every right to do that.
Okay, that's helpful. What are the treatment options for anxiety disorders? Are there only two? Is it medicine and cognitive behavioral therapy? Are there other methods? I don't know. What are the different options that we have available to us?
Oh, yeah. So therapy models vary. So we know, like, CBT is a therapy model, the one that you just mentioned, that has shown to have great success when it comes to anxiety treatment, but it's not the only treatment model that's been effective. And depending on your experiences, there may be other treatments that can be incorporated that can be really effective for you. So things like EMDR, and I'm not an EMDR therapist, but there's ACT, and a lot of them are going to be acronyms. So
Okay.
just know that there are, so I can just say a bunch of letters, yes, so there are different types of therapy models, not just CBT, because for some, CBT may not be, what aligns with them the best, and that's okay. And so that's another thing too. When you begin a relationship with therapy, if you are with a therapist and it really is not serving you and it's not working, it is okay to have that conversation with your therapist. You can work with your therapist to figure out, is it best to stay and keep working through this? Do we need to refer elsewhere?
I'd love to put into that. So what about those of us who may say, oh, I don't want to tell my therapist that this isn't working for me. I don't want to hurt their feelings. Like, that's gonna, like, some people are really like, I'm a people pleaser. I don't want to say that. Our therapists trained to get their emotions out the way. And if you feel like you're in a session that it's really not serving you, like, do you need to speak up instead of staying in something and maybe paying for something that just doesn't serve you at all? What are your thoughts for that?
Yeah. One, to consider your therapist and your therapist's feelings is a very human and caring and thoughtful thing. And if the only reason why that's happening is because of your anxiety and you can't deal with the discomfort, that's something in itself. But your therapist has training that has helped equip them to be able to have those conversations, to hear from you that something may or may not be working, right? Okay. So can I speak for the entire therapeutic community? No, I can't do that. But it is every person's right to recognize if a service that they are wanting for themselves is not beneficial, or maybe, harming them more, or is just not working, to be able to say so.
Yeah. No, thanks for that. And I think just even pigging back to when we were together on Sunday, there were a couple of pointers that I saw in the comments that people really liked and stuck with them. And I remember you had me do this because I was going to ask, what's one small step I can take right now to feel better? And I remember you had me holding a water bottle and you said, close your eyes. And I want you to imagine like really, really hard that you threw this water bottle and it exploded everywhere and it was a big mess or whatever. Open your eyes. And I realized that I was still holding the water bottle. And one of the things that you taught us was, you said, you are not your thoughts, you think thoughts. You are not your feelings, you feel feelings, or something like that. And you are not your behaviors. And so maybe just kind of correcting me if I messed that up a little bit, but really helping us to understand that for those of us who think a certain way, just because we think something doesn't mean that we are what we thought about. Right?
Yeah, absolutely. And I enjoyed you doing that exercise. It was, I think you thought that the exercise was going to be like, I don't know, me
really telling me that
you but so we have what we call like cognitive distortions, right? We have a bunch of different types of cognitive distortions. And as human beings, we all have distorted types of thoughts at some point in our lives. And distorted thinking is like, there's different types, like all or nothing thinking, where we cannot see a gray or in between. Either it's always this, or I never get what I want, or I always have bad luck. That very like is one way or the other. This is why I always incorporate the use of and, because a lot of times it's not an or, it's an and.
Yep.
Or emotional reasoning, right? Where that's where like, just because I feel this right now, then that means it has to be true because I feel this way, right? Like if I looked at you and I thought, man, I really feel like Leslie doesn't like me, just because I feel that, and I'm having that actual emotion that's connected to that, I'm telling myself, well, it has to be true because then I have this feeling and this thought is there, so that must mean that that's true. But meanwhile, that's not accurate. And there's other, types of like discrediting the positive, where we just, if something positive happens, we're like, yeah, but that's not really a big deal.
Over it, yeah.
Highlighting or only selectively seeing negative things, or kind of self-fulfilling prophecies, or another big one with anxiety, catastrophic thinking, where we think the worst thing. I think, the old saying of like turn a mountain into a molehill. No, opposite.
Making mountains out of molehills.
Yeah, there we go. So that's catastrophic thinking, right? Like we have something and we're gonna blow it up to the worst possible thing ever, and that's what the only possible thing. And so, but we all can do this, and we all will do this. But being able to start to look at when we're doing that and go, okay, that's not really helpful, or like that thought's not accurate. I'm catastrophizing that, right? Like that's a straight mountain. That's not. I've turned that into something that it's not. That helps us to then do what we need to do to start to shift and have our thoughts go in a different direction. You're not going to get rid of this stuff.
Yeah.
But you can look at it and then see how it's not helpful, and then start to, align yourself with things that are more helpful.
Well, I have a question, and then we can get to resources. I'm trying not to keep people past an hour, but I remember a little bit earlier we were talking about self-compassion and validation and like the best friend, thing. I have a question. Let's say we've been best friending, and I've been affirming you, and all this kind of stuff. Does there come a point in the relationship though where you can say, all right, that's enough. We gotta, I mean, can we do that, or is our responsibility to always be loving and no, it's okay? And I mean, can we coddle someone so much that they're just so comfortable in things? Like, are we allowed as loving friends to be able to push a little bit and say, all right, girl, come on, like, you all right, you know what I
Yeah,
mean?
absolutely. So if we go from, all right, so the Bible that you teach from, does it say that love is just coddling and just ego stroking and being nice all the time and making it fuzzy and that is not from the Bible that
My
you teach
Bible
from.
says that the Lord chastises those God loves.
Right. And then if we look at it from like a parental standpoint, right? There are times from a completely loving and compassionate place that you utilize things like discipline and order and clarity and accuracy. You use those things, but you use them from a place of love and compassion, right? And so to that question, yeah, love doesn't, being loving and self-compassionate towards yourself or towards others, it doesn't mean that we disregard rational thinking or we disregard useful tools and awareness, or we throw all of that out the window and we just act sugary sweet and nice and use a soft voice with ourselves. No, sometimes because I love you, I'm going to speak accurately to you. Because I love you, Megan, that thought is not helpful. Girl.
Right. There is a such thing as tough love. And I just really feel like stereotypically we have really loved the heck out of love.
To laugh. Chris, PC in the chat.
But I just feel like when we think of love, we only think of sprinkles and rainbows and butterflies and everything nice and nothing like tough. And it even makes me go back to the quote you taught us on Sunday too. When it comes to certain things, like we've got to learn how to discern the difference between danger and discomfort. And I feel like that, I guess sometimes that can be the same thing with a healthy confrontation. Like me telling you about this, I'm not putting you in danger. I'm not putting myself in danger. This conversation is uncomfortable for me, but sometimes the right way or the loving way does cause some discomfort.
Right. The idea that discomfort means bad is something that we have an opportunity to take a look at and make sure that we have that in our thoughts accurately. So there are things in our lives that are going to be uncomfortable. That's how that experience will be. That doesn't mean that that's not something that's necessarily healthy or helpful or it isn't useful. There are other components of our lives that are really helpful, like the building of resilience does not come without meeting our discomfort. We cannot actually build resilience without that component. Would it be resilience if we did not include the uncomfortable, the difficult, the things that we're overcoming, facing adversity, and recognizing that we can face adversity and move forward? Some things that we learn are going to be learned from a place that is not comfortable or pleasant. And so, and even things that are painful, for example, like there are medical procedures that are going to be painful first in order for the healing to be accurate and helpful. If you have to get your shoulder set back into place because it's dislocated, I don't know about you, but that's not not
That's uncomfortable.
comfortable.
Right,
It
right.
hurts.
Yeah.
And our pain response actually doesn't mean having a pain response is a part of our human makeup, and it's there also to be helpful to us. It lets us know that, hey, there's something that's going on here in this present moment that we need to pay attention to. Something's not quite right. And then from that, we're able to use that and do something with it that can be helpful. But and this is where anxiety, the way it kind of gets in our thoughts, it'll say, you can't tolerate any of that. You got to avoid all of that because all of it is dangerous and it's going to take you out. So you got to avoid all of that. But being able to accurately go, okay, that's just discomfort. That's not actually danger. I'm uncomfortable in this moment, but this feels awkward, but that's not actually something that's unsafe.
No, that's true. And I would venture to say that some of the best growth comes from discomfort. I think about even biblically, the vine and the branches, or when it comes to plants and pruning season, like the purpose of pruning is not to just be like, oh, you've grown too big, like you're not good. Pruning actually stimulates growth. And so I think that's kind of the same thing that we can apply in our lives as well. We had the other question, and I know we have to get ready to talk about resources. But do you have a list of recommended therapists in this area? And what do you do if you have a therapist that you don't like? How do you transition to a new one? Do you just stop going? Do you ghost them, or do they deserve a conversation?
Well, listen, at the end of the day, you will choose. Your choices are your choices. I will say that if you choose to ghost your therapist, keep in mind that that is a choice that you yourself, you're making that choice. And so if we own that, like, I chose to stop going to therapy. If I still think that I need therapy, I may have to add an additional choice, right, to seek out a new therapist. So I don't have a list of like actual named therapists, but I did kind of jot down a few things that can guide you if you're looking for a therapist. Leslie, you want me to just kind of go into that?
You can, sure.
Okay, cool. So a couple of ways to go about
things that you put on social media as well, but I'll let you talk about them.
Okay, cool. So a couple of ways to start going about seeking out or finding a therapist. One, if you're using your insurance, it's really helpful to go ahead and look and call that number on the back of your card, or most insurance companies, there's a website that you can go on to. Your insurance company will have that information that tells you this is what your mental health or behavioral health benefits consist of. And so you can find out, how many sessions do I get per year or all together? Is it going to cost me anything? How much if I have a copay or a deductible, how much that would be? And then your insurance will have a provider list of providers that are in network with your insurance. And so you would be able to look at that list, and you'd be able to like get that information, and you can go about it from that direction. Another useful tool is platforms like Psychology Today. So Psychology Today is a resource where you can go on Psychology Today and you can look up providers based on a multitude of ways. Like you can look up, I want a therapist to help me with anxiety and depression. So you can look up based on what you're looking for. You can look up based on male or female, or if they use certain types of therapies that you have researched and you're like, I want a CBT therapist. Well, you can go on Psychology Today and look up woman that does CBT that's 20 miles in a 20-mile radius for me, that does telehealth or in person. You can literally kind of put filters and find different therapists that way. Also, if you you definitely can look into whether your job offers you mental health benefits. So there are things like EAP programs and FMLA. And so if you have a human resources department or whoever, you can reach out to them and just get that information. Like what do we have an EAP program? What does that consist of? How do I utilize that? How am I able to use my FMLA when it comes to mental health and therapy sessions and things like that? And if you're in school or your faculty in places, your colleges and universities may have on-site counseling services that you have access to for free or for a reduced rate just by being affiliated or associated or being a student there. So reaching out to your university or your college to find out what mental health resources you have, all of those you have every right to do that.
Well, this has been extremely helpful. I'm so glad we got a chance to do part 2. Thank you for allowing us access to your time. You're a wife and a mother. So we don't take it for granted that you would give us an hour tonight. I'm sure everyone in the comments are greatly appreciative as well. And if there are any closing comments or thoughts that you have in the comments, please go ahead and do that now. I want to wrap up in the next 4 minutes. And then Megan,
can I touch on something?
Yeah, of course.
Yeah, so I know that like you know, we briefly brought up, and we still didn't get to the resources and stuff, but we briefly brought up on Sunday that blending of our faith and therapy. And you know, there's plenty of kind of humorous TikToks and memes and stuff out there of like trying to dispel this belief that if you believe in God, then you can't believe in therapy, or that they both can't exist. But I just want to point out that there are very similar things that we see biblically that are also that align therapeutically, right? So we have scriptures that tell us to cast down vain imaginations, right? So a therapist can help you to observe your thoughts and to be able to recognize when a thought is not helpful, and then to be able to not let that thought control you, but to be able to do what you need to with that thought and move forward in a healthy way, right?
Mm-hmm. And I love that scripture is not promising that thoughts won't come. It's telling you they are going to come. But what are you going to do with that thought when it comes?
Right. Exactly. We have scriptures that say like, all right, if you feel angry, just don't sin. Right? Feel the feeling. But then
I tried to end, but when you bring up the Bible, I like to talk about it. I mean, right, like you've got Jesus, the whole Christ, not the half Christ, the whole one, flipping tables, right? I mean, he didn't do anything that was going to get a strike on his record, but like you can be angry or it's challenging us. Don't go to bed angry, like fine.
Right.
Don't let the sun go down on it, but really validating that anger is an emotion. But what do we do when the anger comes? How will we go about processing that?
Right. We have examples where Jesus decided to he noticed that he needed to separate himself and to go and like meditate and just think on things that were going to be helpful because he was going through a really tough time, right? Those are principles that are very, that's therapeutically sound. Those are some of the same things that you will kind of hear therapeutically are very helpful, right? If you're really, it can be helpful to separate yourself and to meditate and to be still for a little bit, to gather your thoughts, to think things through, to utilize helpful affirmations, to speak things to yourself that are accurate and true even when you have certain feelings, or even when other thoughts may be there as well. And so the idea that you wouldn't be able to incorporate both of these things may not be very helpful to hold on to, right? Like, we can incorporate both of those things, and therapeutically, it can be very helpful to utilize your faith and your spirituality as a meaningful and intentional component to your well-being. Mm-hmm. The structure of getting up and if you add structure, like, you're like, okay, I need structure because that's going to be helpful to me right now. And so one of the things that I'm going to add structure to is I'm going to get up and I'm going to make sure that I go to my church service, because that's going to get me out of the house, and that's going to help me to engage in my environment, and that's going to help with my managing my depression, right? Or I'm going to use I'm going to incorporate worry time, where I'm going to say, all right, I'm going to spend 15 minutes letting myself worry. And then at the end of that, I'm going to actually hand that over to God. That's how I'm going to utilize that. I'm going to worry, then I'm going to give it all to God.
As you're saying that, I mean, I even think of Jesus. So first of all, Hebrews 4:15 says, we don't have a high priest who is unable to empathize with our weaknesses, but we have one who has been tempted in every way, just as we are, yet he did not sin. And how you were even saying, like, pause and take those moments for your worry and your anxiety. I think of Jesus in the Garden of Gethsemane, where he went to have prayer with his Father, and he said, Lord, if it is possible, let this cup pass away from me. Like, I am sure, knowing that you are getting ready to be betrayed and die on a cross, like, that's got to be anxious. You've got to have some sort of anxiety, but for, like, the person that we put our life's hands into, to be able to pray to his Father to say, let this cup pass from me. Like, I'm sweating blood right now. This is such a big deal. If Jesus could go through something and make it through, I think that we can too. So I do think that they're interrelated. It's not either or. You really can, like, marry the two, science and spirituality.
Yeah. Absolutely.
But let's see, you got a couple comments. Thank you so much. So informative. We need to talk about this more. People are grateful. You're getting a lot of thank yous that it was informative. So that is great. Thank you for this information.
Yay.
Good information. Thank you for your expertise and for including the conflict many have with going to therapy as a Christian. Oh, I got to ask you this last question, and I'm sure it's subjective.
Okay.
But are there pros and cons to Christian counselor versus non-Christian counselor? Like, let's say you go to a counselor who does not label themselves as Christian counseling. Like, is a counselor's job who is not faith-based, like, would they still honor my beliefs or sway my opinions? Or if I'm a Christian, do I need to stick with the Christian? I mean, do you have thoughts on that?
So there are so many different types of therapists, right? Even down to their niches and the types of therapies that they specialize in. And as the client, you have every right. If for you, you know that what aligns with your values is to have a therapist who utilizes Christian components in their therapy models, in the way that they practice therapy. If that is something that is really important to you, you absolutely can seek that out. And there are therapists who incorporate Christian practices into their therapy. Now, if a therapist does not incorporate that, does that mean that they're going to belittle your faith? No. And really, you decide if that is a component that you want to bring into the room. A therapist isn't going to tell you that, well, I can't speak for all therapists, but telling you, like, don't you bring up your faith, because that's not something that, like, is okay to do. That's not really how that goes. So, but if you're like, I really want that incorporation into my therapy, you can seek out counselors or therapists who have that as a part of their specialty.
Okay. So I wonder too, like, could someone, if they were going to therapy, could you ask your therapist, maybe it's not a Christian practice per se, but the
Mm-hmm.
therapist is a believer. Could you kind of say that up front, like, hey, I'm a person of faith. I know this might not be like Christian counseling per se, but are you a believer? I mean, can you say that? Or is that kind of like your therapist does not owe you anything when it comes to faith and beliefs and
Well, I
practices?
wouldn't say it's like a matter of owing, but one of the things from a professional standpoint that we are mindful of is our professional boundaries and disclosure, and making
Okay.
sure that what we're doing is focused on the client, and that we're not blurring those lines professionally. And so, if clients are like, hey, what do you believe? And where do you go to church? And typically a therapist is going to create that professional boundary there, because it really isn't about us, it's about the client, and making sure that we are providing the best therapeutic space for them.
Okay. And then one more question. Is the goal of, and maybe different therapists have different answers, is the goal of therapy to see a therapist forever, or to go for a certain amount of time and then you internalize and learn the practices yourself when things come up to be able to deal with it?
So that one's one of those subjective ones too, right?
Okay.
So a client's goals are going to be centered around their needs. And so
Okay.
you may have someone who their needs are short term, solution focused. We got 3 months. I've got this specific particular thing I want to work on, and that's it. And then you may have someone who has more long term goals and long term needs. And so their therapeutic journey and process is going to look very different.
Gotcha. Okay. No,
Mm-hmm.
that's helpful. And then in thinking about that, I guess there is also a difference between like a counselor and a coach, right? Are those two separate things?
Yes. Mm-hmm. Coaches tend to work with clients, and I don't want to like really venture there because that's not my level of expertise at this time. But coaches tend to work with clients on just accomplishing their goals and accountability and those areas. And counselors and therapists um, work work differently in that space.
Yeah. So I knew that. I just wondered if there was a loving way to. I've had my share of people who forsook counseling for coaching when they really needed a counselor, and they're like, "I'll just get a
Mm-hmm.
coach." And it's like, how? I mean, does a person have to come to the realization themselves, or is there a way you can lovingly say, "Hey, a coach could be great professionally or something, but like, I don't know. Is there a way to say that, to segue into it, or is that kind of like that's none of your business unless you really have a strong relationship?
I mean, so that's the thing, right? Like if you're talking about someone who I I think effective communication is really helpful, no matter who you're talking to. But also,
Mm-hmm.
if this is someone who you barely know and you're inserting that opinion into their lives, it may not be as effective. But
Okay.
if you're saying, this is something that I see and I want to share my opinion with the person, versus telling them like, you need a counselor instead of a coach. You need therapy. You don't need no coach. When we use you statements,
Right.
we
That's
tend
judgment.
to create, yeah, we tend to create defensiveness and offensiveness, and like you said, judgment. So it can be helpful to use I statements instead. Like, I'm thinking this is my thought about it. but always recognizing that that part's not in your control. Each person has their right to their own experience, their thoughts and their feelings, and what they're doing. We can share our thoughts and our feelings, and that's what's in our control. But like if I take something and I say I want to share this with you and I put it down, that's the part that's in my control. What happens next, if you pick it up and what you do with it, that's what's in your control.
That's good. No, that was helpful. And I have to be careful of that even when it comes to preaching. I've always been told steer clear of second person language. You, because then it's always somebody else. And it's not inclusive. It's not us. But no, I think that this has been helpful. I don't know if there was anything else you wanted to say about resources, or if you wanted to wrap up, or have some other closing words, or maybe you want to say a prayer over the people. I don't know.
Well, resources, and I think you said you're going to share on some information, but I will say, therapy is definitely a resource for everyone. You have a right to that as a human being. How that can be incorporated in your life is different for each person. But there's also other resources that you can incorporate too, which include like books and reading books that can help you to better understand what anxiety is and how to learn strategies that can help with that. Amazon is a great place to find some books and all kinds of resources. And then coping strategies that could be helpful with managing anxiety, like coloring books. And that may come off as like childlike or trivial, but the tedious engagement can be very therapeutic and relaxing. And it's very grounding because it pulls you, if you allow it to, it can pull you back to just the present tense moment. And so that's really helpful. There are affirmation cards or affirmation apps. Now with technology, there are some really useful apps that can be, that we can incorporate on a daily basis. Apps that are well known like Calm or Headspace. Shine is one, and Shine is pretty cool because it was created by two women that are women of color. And so they were intentional about making sure that we have an app that has voices that sound like us. And so if that is something that aligns with your values, that there's apps like that out there. But there are some great resources out there for us to, and maybe you're not at a point where you need to go to therapy, on a consistent basis, but adding the things in that are helpful and healthy, that's just gonna benefit you. So not think of it like brushing your teeth versus getting a root canal. We brush our teeth regularly as a preventative resource. It helps to take care of our teeth in the present tense. A root canal comes after the fact, and now we're dealing with a crisis. Neglect, so if we think about it, and so if we think about the usefulness of brushing our teeth, that's adding those healthy practices on a regular basis. And so that helps with maintaining your self-care and maintaining your well-being. And then there will be other resources that you'll need in crisis-related stuff, but it helps to kind of lower those possible crisis situations.
No, wow, that was helpful. So there are a plethora of resources that are out there, easily accessible. And so, technology has come such a long way where if we need help, it's literally like at the palm of our fingertips.
Yep.
The tip of our fingers, however you say that, that's what it is. That's where it is. But so, I mean, the hour is getting late. Again, I'm so thankful and grateful having a conversation with us. For everybody who tuned in, we also want to celebrate and say hello to everybody who's going to be watching the replay, because there are some people who
Yeah.
won't get to catch it live, but they will watch the replay. Thank you so much for those of you who will be tuning in later. And also, if you're watching, let us know where you're watching from too. Those of you on the replay, we'll go ahead and close out. You're good, Megan?
Yeah, I
Okay.
am.
I'll say a quick prayer over us. Lord, I thank you for this day. I thank you for just another opportunity to be here. We take space, God, right now to just pause and to breathe and to celebrate the fact that we can be right here, right now, in the present moment. I thank you, God, for those of us who are on this call who may be dealing with worry or anxiety. I pray, God, that this conversation even was therapeutic for many of us, that we got some of the answers that we needed in our situations. I pray, God, even now that you would begin to help those of us who may need the help to get the help that we need and to not be ashamed about it. I thank you that you are removing stigma and judgment away from getting the necessary help that we need. I thank you for an avenue and a place to be able to talk about these things without judgment. I even pray for the resources for those who may not have them to be able to get the help that they need, that you would provide them. And I also thank you, God, for those who may even be struggling with insomnia or other things that are preventing them from having a sweet night's rest. I pray, God, that tonight all of that changes. We still believe in the power of the Holy Spirit, and we thank you for that gift of Holy Spirit that you have given to us. And so we access and activate that now. And Lord, I thank you that we are even able to cast all of our cares upon you because you truly care for us. So, God, we just release all of our worries and our anxieties and our cares to you right now. We thank you also for Megan taking time out of her schedule to educate us. We pray that you would bless her and her business and her endeavors and her family. That they'll go to higher heights and deeper depths. And any prayer requests that may be on this live right now that I may not have seen or may not have had a chance to mention, God, you know their hearts, you know what they need. And I pray that you would be God in that situation. Bless our time together. Keep your angels encamped around and about us. Watch over, protect, and keep us. In Jesus' name, amen.
Amen.
Amen. All right. Well, it's been a blast. Thank you, everybody who has
Yeah.
tuned in. Don't
Thank you,
forget
guys.
this. Yeah, we're so hyped that you came with us. Don't forget this upcoming Sunday is the breast cancer walk. So if you did not get a chance to see our shirts, there it is right there. It is going to be Legacy Maker Sunday. So they're going to be $20, Cash App and cash only, limited supply. We're going to be walking for breast cancer awareness immediately following service at 11:30 a.m. We're meeting at Newport News Park. And this will not be the last time that we address mental health because we believe that it is important. Jesus, yes, will work it out, but he has given others and anointed people to help us work it out too. And so
Yeah.
there is that. And thanks again. We'll see you all soon.
You're welcome. Take care.
All right. You too. Good night.